Hello, students. Welcome to part 2 of communication. And in this lecture, we are going to talk about therapeutic communication and nurse patient relationship. So, what is a therapeutic communication? As we have talked in previous class, that communication is exchange of ideas and your emotions or the information. So, here we are talking about the therapeutic communication. So, it is an interpersonal interaction between a nurse and a patient for the purpose of the treatment. Okay, so it is a very focused conversation. It is focused on the treatment, it is focused on the betterment of the patient or the unmet needs of the patient. So, therapeutic communication is defined as face to face process of interacting that focuses on advancing the physical and emotional well being of the patient. So, what are the goals of a therapeutic communication? Okay, so the first goal is establishing a nurse patient relationship, NPR. We have to make sure that we are making a particular nurse patient relationship, therapeutic relationship, in which we work for the betterment of the patient. Next goal is to identify patient's unmet needs. Okay, while we are talking to patient, while we are sharing the information with patient, okay, so we have to find out the unmet needs of the patient or the information related to their physical, emotional, or related to their mental health. Next is help the client to ventilate thoughts, doubt, and anxiety. And this is also the goal of therapeutic relationship. We have to help the patient ventilate. Okay. Next is teach the patient about self care and involve the family members. This is also the part of therapeutic communication. And the last here is guide the patient to cope or recover from the illness. Okay, how to cope up with the illness and how the patient can recover from that illness, that is also the part of therapeutic communication. So, what are the methods of therapeutic communication, or what are the techniques of therapeutic communication? So, there are so many techniques of therapeutic communication: active listening, empathy, hope, humor, and others are sharing information, sharing your feelings with your patient, confirming and clarification, paraphrasing, focusing. Broad ended question is also a technique. Providing leads, offering self, and reflecting and summarizing. These are all the techniques of therapeutic communication. So let's discuss this. First one is active listening. Okay, so active listening is being attentive to what the client is saying verbally or non-verbally. Here we don't only have to listen to the words, we have to see the non-verbal cues also. And how you can do that? By sitting face to face with the patient, having open posture, lean forward, and make a eye contact with the patient and relax. What is the value of this? How it helps the patient? It conveys the acceptance, and it conveys that we are respecting the patient. That's why active listening is a therapeutic communication technique. Next is broad opening. And what is broad opening? Broad opening is encourage the patient to select the topic of conversation and decide what to talk about. And how we can do this? Like the question we can ask: what's on your mind today? Okay, that means we are asking that what is going on with the patient, what would you like to talk about? We can ask these questions, and how it will help us convey the acceptance and respect for the patient, and it also increase the interest of the patient because the patient is selecting the topic. Next is sharing observations. Okay, making observations by commenting on how other person looks, sounds, or act. And how you can do it, like, oh, you look so tired, I haven't seen you eating anything today, and how it is helping us in. Like, it is conveying the sense of understanding to the patient, like the nurse is understanding the patient and caring for the patient. Next technique is accepting. Acknowledge what patient says, affirm that they have been heard, and acceptance isn't necessarily the same thing as agreement. Okay, so what we can do here? Make an eye contact with the patient and say, yes, I understand. Okay, and it doesn't mean that we are agreeing with the patient, but we are understanding. So patient feels like nurse is listening and taking him or her more seriously. Next is offering self. Offering self means we have to spend the time with patient. Here we can talk, or we can only sit with silence, or we can listen to the patient, but we are spending some time for the patient. Okay, and how we can do this? We can watch TV show with the patient. We can simply sit with the patient. Next is sharing empathy. So it is ability to understand and accept other person's reality and accurately perceive the feelings. So what we can do in this, like it triggers emotional response. What do you want or not being able to do? How did you react when you had such experience? We can ask such kind of questions. Okay, it helps in understanding the person's reality accurately. Other than that comes another techniques like sharing hope, communicating a sense of possibility to others. Like, I believe you will find any way to face your problems or situation. I have seen your courage in the past. Something like this. Okay, it will provide encouragement to the patient. Another is sharing humor. As we all know, humor is also a very important part of our communication. So patient is encouraged to release the negative energy through the light fun or enjoyment. For example, patient can make a paper boat and play with it in the rainwater, help him or her to remember the childhood experiences. So it will provide some light-hearted experience to the patient. Next is theme identification. It is another therapeutic communication technique. Identify the main issues or the problem and arise frequently during the interactions. Like, I have observed that all the experiences you have told, you have been cheated by your friends, or you do you think this is the main issue, or your family members are not properly respecting you? Do you think this is the main issue? So this is how you can find out the main theme, why the patient is bothered. Okay, so this is theme identification. You have to find out the main issue here. Next is the giving recognition. Okay, so what is giving recognition? It is just acknowledgement of the patient and his behaviors without giving an overt compliment. Like, I noticed you took all of your medications. Like, this is giving recognition for a good work. Next technique is reflection. Understanding patient's idea correctly by directing patients back to the idea. So what we can do as a nurse, what kind of question we can ask here? You are feeling stressed and anxious, and it seems to be related to meeting you had with your family members yesterday. So we can reflect so that we can understand the patient behavior correctly. Is it because of this or because of some other reasons? Using touch. This is called as therapeutic touch. So nurse places his or her hands near the patient's body with the intention to help or heal. So holding a hand, it provides a convey the sense of assurance and importance to the patient. And the silence. So silence is also a communication. Okay, so nurse stop talking, remain quiet for a moment, then ask about what the patient is thinking and feeling. So how you can do it? Sit with the patient in an open posture and without interacting verbally. And how it helps? It helps the patient to get insight and consider what has been communicated verbally. And the next one is informing. Relevant information is communicated. Okay, for example, that we are recommending ECT, that is controlled medical procedure, that the seizures will be induced after giving the anesthesia, etc., etc. So you are providing all the important information here. It helps the caregivers, it helps the patients to make the decision as per that. So these are few techniques of the therapeutic communication which are very important when we are communicating with the patient. Other than that, there are some more techniques we can discuss here. That is focusing. What is focusing? That, like, we have to focus on a single idea here that is expressed by the patient or just shown by the non-verbal cues. Okay, next is clarifying. Clarifying is restate an unclear or ambiguous message. Like, we are not able to understand something or we are not getting that, we have to restate that. Like, you are saying this, I didn't understand, what do you mean by saying sicker than usual, or what is it different now? Okay, so what is the meaning of this as per patient? Paraphrasing or restating. So repeating the patient's main idea briefly using one's own word. Okay, so whatever the patient has told you, you have to repeat that. Like, you are trying to say, like, this is happening, am I correct or not? So this is paraphrasing. You are just paraphrasing whatever the patient has said so that you can understand that properly. Next is questioning. To seek information needed for decision making, ask only one question at a time and fully explore one topic before moving to the another area. We don't have to jump the topics. Okay, we have to understand one topic properly here, that is with the questioning, and one question at one time. Next is summarizing. Pulls together information for documentation. So it gives the client a sense that you understand whatever the client has said to you. Okay. Next is self disclosure. Nurse intentionally reveals personal experiences about self to the patient for the purpose of emphasizing both the similarities and differences in the experiences. So what it will tell the patient? It will tell the patient that the uh, uh, we can say genuineness of this communication or the honesty of this communication. Another technique is confrontation, sharing consistencies, discrepancies in patients' feelings, attitudes, beliefs, behaviors. Okay, like example is, you say you have already decided what to do, yet you are still taking a lot about your opinions. So we can help to get patient aware of their behaviors or the maladaptive behavior, that is confrontation. Next is suggestion, discussing all possible ideas, alternatives, options with the patient so that the patient can make a informed decision. So these were all the communication, therapeutic communication techniques. After that comes the barriers of communication, or we can say what are the non-therapeutic techniques which will hinder our communication. So communication is based on nurse-patient relationship. However, there are many barriers in the communication. So what are these barriers? First one is asking personal question. Okay, if we don't require these questions, we shouldn't ask them if they are not appropriate for the self curiosity, for the our self curiosity only. Okay, do not ask the personal questions. Next is giving personal opinions. Okay, we can provide our information, we can provide similar, we can say, scenarios to the patient, but we cannot provide them the personal opinions that will interfere with the communication. Changing the topic. Okay, so while conversation, nurse should not change the topic very frequently or change the subject very frequently. That means patient will understand that you are not interested in the topic that the patient is talking to you. Next is cliche or automatic responses. Okay, so here if like patient is talking to you about the fear of needles and you are saying like everybody is afraid of needles or it is like how it is done, so we don't have to provide such kind of responses to the patient. Other than that, we have to try to understand the patient and make them understand the procedures. False reassurance. Okay, so false hope is also a barrier in communication. That means you are not correctly or honestly telling the patient about his or her condition. Like we are telling a terminally ill patient like everything will be fine, and that is not how it is done. So it is questioning your authenticity as a nurse or the authenticity of your information. Okay. Next is sympathy. As we all know, in nursing, we focus on empathy rather than sympathy. So, what is sympathy? Like, nurse is not feeling like patient. Okay, she is not feeling not on the patient. Example: I am extremely sorry for your amputation. This shows nurse is feeling sorry and sympathizing with the patient, and we are focusing on the empathy here. Next is physical and mental discomfort. At the time of physical and mental discomfort, that can be a barrier in communication. When the patient is in pain, they will be highly distracted by the pain and they cannot be able to communicate more effectively. Approvals and disapprovals. Okay, patient may bring up situation where nurse have to express her opinion or judgment. In this case, nurse must not impose their personal attitude or value or belief or judgment on that particular. If they are imposing their judgment, that will be interfering with the communication. Next is the jargons. Use of medical technology, use of medical terminology, technical term, which patient is not familiar, that may cause confusion. So we do not have to use jargons or any medical terms which patient might not know about. Okay, we have to talk in their language. So next is arguing. So nurse must not argue with the client. If you are not agreeing with something, you just have to tell them, but you don't have to argue with them. Okay, we don't have to challenge the patient's belief here. Gossips and rumors, like this is the defamation we have discussed. We do not have to follow any gossip. We do not have to discuss the patient or his problem or his personal life with others until unless there is something that needs to be told therapeutically. Giving advice. As I told you here, we are not imposing our ideas, our suggestion on the patient's life. We have to refrain from giving any kind of advice. Time constraint. And the one barrier of communication is time constraint. Like there will be not enough time for the nurse-patient relationship, or the we can say not a proper time for the communication, that can also interfere with the communication. So what are the mnemonics in communication, or the barriers in communication? So it is J has an opinion on personal topic and automatically reassures, physical sympathy, arguing, gossiping, and advising with time. It is a jargon. You can use this sentence as a mnemonic to remember the barriers of communication. So J means jargons, the medical terms, technologies. We do not have to use them. O means opinion, giving personal opinion on a topic. Personal, asking personal question from the patient's topic. Changing topic very frequently. And approval and disapproval of information. Next is automaticity. Like I told you, you don't have to tell automatic messages or automatic response to the patient. Reassurance, that includes false reassurance. Physical or mental discomfort may hinder the communication. Sympathy, like have to focus on empathy rather than sympathy. Arguing should not be done with the patient. Gossiping and rumors are the defamation, and those are intentional thoughts, and we do not have to advise the patient, and we have to communicate within a time constraint. So time can be a barrier in communication. So these are all the mnemonic or the barriers in communication, and you can follow this sentence. J has opinion on personal topic and automatically reassures, physical sympathy, arguing, gossiping, and advising with time. So it will help you to remember the barriers in communication. So students, next is professional communication. So professional communication is whatever kind of communication we do in our organization. It can be in oral form, it can be in written form, it can be in visual or digital form, but it's done in some organization or in some professional organizations. Like, what is professional communication? It is the distance between two individuals, different zones of communication. And let's discuss what are these zones of communication. One is professional communication, and the first zone is intimate zone. Intimate zone is close contact, like a communication between a mother and child, a communication between like parents and children. So these are intimate zone, and here you can communicate within 0 to 5 meters of range. And next is personal zone. Personal zone is distance between two close friends. Okay, and the distance between this communication is not that too much. So it is like 5 meter to 1 meter distance will be there. Social zone. Distance maintained while interacting with acquaintances, like distance you maintain while you are talking to your colleagues or some other people you know. Okay. And the public zone. Distance maintained while you are talking in a meeting or at a public place. That is public zone. So what are the principles of professional communication? First one is communication is a process. Okay, communication is a process like we have studied in previous lectures, and it includes message, sender, channel, and all the kinds of we can say steps there. Communication is not linear but circular. So most of the time communication is circular, as you can see the process. After feedback, there is again message to the sender, and all the messages sender to the channel to the receiver to the feedback to the sender. So it is a circular motion, not in a linear. Communication is complex. Yes, communication is complex, and at the message once received has a feedback as well as response to it. Like a message is received, according to the reply is given, and action should be taken. Communication is irreversible. Okay, so once you made some interaction, once you have communicated with someone, you cannot reverse that. You cannot cancel or undo that message while you are after that you have communicated with the person. Communication involves personality. Okay, so as we all know, there are many factors which will be influencing the communication, and some of them are your personality, your behavior, your language, your culture, your attitude. So it includes all. So communication is a process. It is a circular, not linear. Communication is complex, and it is irreversible, and it includes the whole personality of the sender. So next topic here, student, is nurse-patient relationship. So as the name is suggesting, it is a interaction between nurse and patient. It is a therapeutic interaction, or we can say therapeutic communication between nurse and patient for the purpose of their treatment. So what is the purpose of this nurse-patient relationship? So first is identify and explore patient's current needs. Whatever the needs are there, we have to identify, we have to explore them. We have to develop adaptive problem solving approach. After identifying the problem, we have to develop approach or plan for to solve that problem. Develop adaptive coping skills among the patient. We have to develop the skills how to cope up with that problem or how to solve that problem. Change maladaptive behaviors to adaptive. So while we are identifying the needs of the patient, we will be finding some adaptive behavior, some maladaptive behavior. So here we have to identify them and change them into the adaptive behaviors. Promote patient's recovery. Okay, so while the nurse and patients are interacting, they have to focus on the patient's recovery and improve the patient's functioning as an individual. So what are the elements of a nurse-patient relationship? The first one is altruism. Like professional nurse should be passionate about her services to the patient, to the family, to the community, and she has to work for the greater good of the patient. Ethics and responsibility. So while the nurse is communicating with the patient, she has to follow all the ethical principles. She should follow proper manners, behaviors, and her activity should reflect the ethics and accountability. Next is communication skills. So while the nurse-patient relationship is there, there should be proper communication skills. She should have a proper therapeutic communication skills so that she can acknowledge the patient and she can identify the problems. Those should be identified at the time of communication. Next is genuineness. Honest therapeutic relation should be there with patient and nurse. Okay, there should be clear communication between nurse and patient. Respect. While nurse and patient therapeutic relationship is there, the nurse and patient should respect each other. Okay, there might be differences in the values, but they should respect each other. Empathy. It is the ability of a nurse to accurately understand the patient's current feelings and meanings and communicate this understanding to the patient. That is empathy. Concreteness. Okay, so nurse should be concrete and she should communicate information in a clear language, in a concise language without using any medical terminology. Confrontation. If you are finding something that behavior is not good for patient, or you have to confront that with the patient. Next is immediacy. Immediacy involves sensitivity to patient's feeling and willingness to deal with these feelings rather than ignore them. Okay, so here we have to deal with the patient's feeling rather than ignoring them. Nurse self-disclosure, as we have discussed in the therapeutic relationship, it is a type of therapeutic communication, like where nurse will tell her similar experiences to the patient so that patient can feel a sense of, we can say, acceptance. Okay, so that is nurse self-disclosure. So ways to promote respect and positive regards in patient, what we can do, how we can promote the positive regards with the patient. First of all, we can call the patient by name rather than calling them bed number or etc. Next is spend time with the patient. We can spend time with the patient. Even we can communicate, or we can just sit with the patient. Actively listening with the patient. It will enhance the positive communication. Be open in responding to the patient and respect patient's autonomy. Autonomy is decision making. So we have to respect whatever the patient is making, and remain unconditional is also a part of to provide positive regard to the patient. So what are the phases of nurse-patient relationship? The first is pre-orientation phase. So in pre-orientation phase, preliminary work learning about the disease condition and how to approach with the patient. Okay, we have to learn what is the disease condition, what kind of patient is coming, and how we have to deal with the patient. Next one is introductory phase. Now here the patient is in front of nurse and patient are introducing each other. That is introductory phase. Next is orientation phase. Here the nurse and patient orient each other about the purposes of this particular relationship, how they have to talk, what kind of problems they can have, and how they will fulfill those problems. solve those problems. Working phase. In this phase, whatever the plan they have made in the orientation phase, they will work on that and they can try to solve the problem. Here, the nurse and patient, they work together to meet the health goals. And last is termination phase. Here, the set goals are met and now the nurse-patient relationship is coming to an end. So this is all about nurse-patient relationship phases: pre-orientation phase, introductory phase, orientation phase, working phase, and the termination phase. So in pre-orientation phase, as I told you, preparation of the nurse will be there, unbiased and without any judgment. Nurse will prepare for the patient. Introductory phase, the nurse will introduce herself about the hospital, about the routines. Okay, this is the first step, and patient will introduce him with his problems, and this is a short phase. Okay, and there are specific aims. Next is orientation phase, like nurse will orient the patient about the purpose and the family members about the purpose, parameters of relationship, formal and informal contract. Okay, so here the nurse and patient, they will be agreeing on something like this is the goal they have set and they have to achieve it. Okay, at the end of this, confidentiality, whatever the information is shared between the orientation phase or between the working phase, that will be confidential within the nurse and patient. Next is working phase. So working phase is something where they will work on the problem. They will use different techniques of communication, they will use different interaction methods, and they will work collaboratively with each other so that they can solve that problem. So what are the barriers in working phase? Now we are talking about, first one is anxiety. There might be high levels of anxiety in patient which may hinder the problem solving. Next is intense emotions. Patient may have intense emotions like anger, self-hate, hopelessness because of illness, and this is a barrier in working phase. Maladaptive behavior. Acting out because of anger, patient is acting out, withdrawing, is not able to talk, intellectualizing, manipulating, denying whatever the solution we are providing to the patient. And resistance. Patient does not want to change, and that can be a barrier in the working phase. So termination phase, as we have worked with all the barriers, we have resolved all the barriers and we have done the work to resolve the problem. After that comes the termination phase, where we have achieved all the goals that we have set at the starting in the orientation phase. So that is termination phase. This phase involves the summarization of work done till now and how to proceed further. So here the nurse-patient relationship comes to an end. That is the termination phase. So why we have to terminate the NPR? What is the reason? First one is goals have been accomplished. We have achieved what we wanted to achieve. Illness symptoms are relieved. Social functioning of the patient is improved, and patient is exhibiting greater independence. Patient is able to perform his daily activities properly. Patient develops adaptive behaviors. We have changed the maladaptive behaviors to adaptive behaviors, and after that we can terminate the NPR. Patient shows emotionally stable and develop a greater sense of identity, and this is also a reason to terminate the nurse-patient relationship. So students, next is communicative effectively with the patient, families and team members. So how we can communicate with different groups. So first of all, we have to have assessment. We have to gather all the information that we require for the communication. Okay, nurse need to ensure that patient does not have any physical limitations like hearing problem, speech issues, and we have to work according to that if he has any. We have to identify the language spoken by the patient. Okay, so that we can understand the level of understanding in which language we have to tell the patient the information, and we have to do that. We have to assess that, identify that. So what are the principles of communication techniques? We have to use appropriate pace and tone of speaking. Okay, it should not be very fast, it should not be very loud or very slow. Accurate information should be provided to patient. Do not be rigid while talking with the patient. There might be some change in the topic and you have to accept that. While conversating with patient, be clear and be specific about whatever you are asking. There should be no ambiguity. Speak truthfully, avoid any kind of false hope to the patient. And also talk with an open mind and without any biasness. Communication opportunities should be utilized as and when available. Okay, you will not say ki right now I cannot talk, and whenever you will get the opportunity to talk, you can communicate with the patient. And there should be some listening skills also. Changing the topic should not done because it is causing barrier in communication. You have to actively and attentively listen to the patient, and do not respond with judgment or opinions, and never show hurried gesture. The patient should not feel like that you want to be hurry this communication, and looks for non-verbal communication also, non-verbal gestures also. So how you will communicate with vulnerable groups? Okay, so as you know, children, women, physically and mentally challenged people, they are the vulnerable group. So how you will communicate with them? If the children is involved, be playful, be approachable, okay, and wear some colored uniform so that children can be attracted and have a part in the communication. Women, be respectful, do not judge, be a judgmental while talking to the women, and while discussing sensitive issues, provide privacy to the women. And while you're talking to a person who is physically, mentally challenged, be respectful to the challenges faced by the patient. Okay, mentally challenged patients will always be accompanied by a primary caregiver. Sometimes they may have a stranger's anxiety, so there should be always a primary caregiver with them so that they can feel ease in the environment. Okay, and the elderly patients, how you will communicate with them? You have a proper communication method with elderly patient. Do not hide your face. Make sure that they don't have any sensory deficit, and if they have any sensory problem, that means you have to communicate according to that. If hearing is impaired, you have to talk a bit loudly, a bit slower, and you do not have to hide your face so that they can read the lips also, lip movement also. So these are some of the tips how you can communicate with the we can say vulnerable groups. Okay, so in this particular chapter, in the first part, we have talked about the communication, the types of communications, and what are the factors influencing communication. And in this part, we have talked about the therapeutic communication, nurse-patient relationships, and how you will talk with the vulnerable groups. So thank you, students. This will be all.